Syndactaly. What is Syndactaly? Webbing of the fingers and toes is called syndactaly. It refers to the connection of two or more fingers or toes. Webbing usually only involves a skin connection between the two areas, but in rare cases may involve the fusion of bones. This is known as simple versus complex webbing. What occurs here is a failure of two or more adjacent digits to fully segmentalize during development. Webbing occurs once in every 2,000 to 2,500 births and is 3 times more common in males than females. Webbing may be discovered during an examination of an infant or child. In its most common form, it is seen as webbing between the second and third toes. This form is often inherited and is not unusual. Syndactaly can also occur along with other birth defects involving the skull, face, and bones. The web connections usually run up to the first joint of the finger or toe, but may run the entire length. Bilateral involvement is found in 50% of patients. Polysyndactyly describes both webbing and the presence of an extra number of fingers or toes. The location of the extra digit goes a long way in determining treatment, if treatment is necessary at all. 3 types of webbing seen in toes. Type 1, zygodactyly, partial or complete webbing of the second and third toes, hands may also be affected. Type 2, synpolydactyly, syndactaly of the lateral 2 toes and polydactyly of the 5th toe in the Sindactaly web. Type 3, associated with metatarsal fusion. Treatment of Syndactaly. Surgical intervention for simple syndactaly of the foot is rarely indicated as the webbing causes minimal loss of function of the toes, it is more of an issue with the fingers. Perhaps the number one reason for surgical intervention is cosmetic disapproval by the patient, rather than loss of function, at least in the foot. Simple syndactaly involves skin grafts to separate the toes. If the two adjacent bones are fused, separation becomes more difficult because many times there is only a single tendon and vascular system supplying the 2 toes, and once separated, obviously the 2 toes would no longer be able to share the tendon and blood supply. In instances where you have a polydactyly, extra digit, if it occurs on the medial or lateral side of the foot, then amputation of the extra digit is the treatment of choice, assuming once again the extra digit does not share a common blood supply with the adjacent digit. In patients that exhibit central polydactyly where the extra digit is in the middle of the foot, it becomes more difficult to determine which digit to surgically remove. However, removing the extra inside digit does not narrow the foot in any way, and reconstruction of the middle of the foot in a cosmetically acceptable fashion can be very difficult. Read the complete article at www.foot-pain-explained.com/syndactaly.html